two special guests today, Marlene Wust Smith and Dr. Marion Mass, both incredible docs, both with really fascinating backgrounds. And I thought we'd just start the topic today with just the way we might on our typical charting. So the topic today is, what's your chief concern? Or as some might say, what's your chief complaint? So Marion, I'm gonna let you start this discussion today. Usually I start going with a long-winded, bloviating type of dialogue, but I want to get you right into this because where you are and what you've accomplished so far in your career, and the journey is far from over. What's your chief concern, or what's your chief complaint?
My chief complaint, doctors are no longer at the table. We're on the menu and we're being cannibalized by the corporates and sometimes our own. How about that?
Okay.
Yes.
Show's over.
We're in.
There we go.
I can't
we
top
all agree. Ding, ding, ding. I think it's unanimous. I'm going to tell
Did
you
I
my
win
story.
the internet?
Yeah.
Wait, did I win the internet?
You got it.
You did, yes.
So, I just want to tell you, Marion, just a few years ago, I was at a general staff meeting, and I've told the story a couple times now, but it still resonates. My hospital is a couple hundred docs in there for our semi-annual meeting, and they brought in somebody from corporate. And I looked around the room after a bit, every head in that room was down. Not once did we talk about patient care. It was all about money, and it was just, you could cut it with a knife. It was that, just such a downer. Seriously, every head was down. I looked around, and what aggravated me the most was that week, or I had two patients who had been in the hospital for several days each, and not one of them had been offered a wash basin. And yet here we are talking about finances, but you can't even talk about doing the right thing or basic human touch of medical care. So that, I just, we've talked about this. You see administrators walking down the hall, and we've abdicated our role in many ways.
Sorry. I knew a nurse that I worked with had her parents hospitalized with COVID last year, and her father was very sick and dying, and the mother was somewhat sick, but not terrible. They were 3 rooms apart from each other in the same hospital, both positive for COVID. This is last year in the spring. The mother was not allowed, this is an administrative rule, not allowed to go visit the father in his dying moments. They both had COVID. I mean, I guess someone could come up with some rule, like maybe during the transport, the COVID would be leaked or whatever. But, I thought to myself when she told me that story, in addition to whoever made this dumb rule, where was the person that was willing to say, no, I am going to do the right and human thing here, and I'm going to wheel that woman into the room with her husband, and you can fire me. And
Exactly.
Marlene and I actually have a friend that had something very similar happen in Georgia.
With her dad, yeah.
Wow. Yes.
It's exactly what I would have done. Exactly why I got fired.
Yeah.
You have to be you got to call BS on this kind of stuff. You can't just sit back and say, no, this is acceptable, because it's not. I mean, what's more important at that point? What else is going to supersede that? Come on. Where's the common sense?
Yeah, I think too, what happened, you guys all know my experience last year. I have one kid who's got spina bifida, and anyways, basically, if I hadn't been his father, he wouldn't be here. But the entire year, we couldn't take him to the hospital because he said, well, you're going to come in with me, right? And I said, well, we can't. And so after trying once, maybe 1st of March, we were in briefly, we never went back. And I just kept giving him oral antibiotics and treating him myself just as best I could. And we survived the year, knock on wood. But what you're saying is exactly right. I don't know where the empathy went. It's
well, I want to take it back. I want to take it back to one thing that Marion said that I think is profoundly important, and that is we spend a lot of time talking about the corporate types and the bureaucrats and so forth and so on. But there are others who should be like us who have taken part in the destruction. Mm-hmm. And again, I got fired because I was willing to speak up. And one of the co-conspirators in that is one of the most visible physicians in the wound care community. So it's not just the business guys. It's not just the people that don't understand what medicine should be. There are people that have been willing to buy in and take part.
Oh, I saw the anesthesia department in my hospital. One guy broke that whole organization, and that's another story. But Randy, your point is well taken. And it, what can you say? I'm just, this got my brain fired up in all different directions. My dad passed in October of 2019, right at the end of the month. So we were a couple months from COVID, and he had chronic lung disease. And I thank God that he passed when he did, because I'm sure we wouldn't have been able to spend those last few days with him. That's just how it goes. And it's so outrageous that people were subjected to this.
All in the name, it's all in the name of safety. And when you look back at the absence of PPE, you can see that it's a way to control yet another part of medicine. And I think those rules are going to remain unless somebody speaks up and says, this is ludicrous. If you're allowing, in some hospitals, they'd allow people to enter just at the dying moment. So it's inconsistent. If you're so worried about COVID and COVID spread, then that makes absolutely no sense. It's a bureaucrat with, some physician leader, saying, okay, we have to do it this way. And those are the same people who allowed our physicians and nurses and other personnel to not have personal protective equipment. So call them out on that, because that's not okay. To suddenly be so worried about safety. It's not about safety. The
cannibalizing happens at very high levels. So this is very interesting. A video circulated on some of the social media groups about 2 months ago. And in the video, I might get his name wrong, but I think it's Dr. Kevin Clower. It might be. The last name begins with a K. It's double K. And he's now high up in the Osteopathic Association. He may even be president, I'm not sure. But at the time that the video was made, it was 2016. And I think at the time he was very high up in the administration of Team Health. Team Health is a private equity-backed organization that owns physicians. And so in 2016, this guy made a video for Doctor's Day. And what he said in the video was, someone asked me recently what I should say to our younger physicians. What's the most important advice I could give them? And I'm paraphrasing a little. And he said, I say the most important advice is just take care of your patients. Don't get involved when you're not going to be able to change something or fix something, because it's all a big system and you're not going to be able to make any inroads. Don't worry about that stuff. Let other people handle it. Just take care of your patient. And maybe in 2016 people would have said, oh, he's right, we have to take care of our patients. But I think COVID has opened up our eyes that if we are not at the table, we're on the table getting eaten. And that very attitude of, oh, if you see an injustice or you see something happening, don't worry about it. Just take care of your patient. We can't even take care of the patient anymore. We can't even give the patient what they need because the corporatization has grown so big. And this is a man who was speaking on behalf of a large corporate group. I mean, it's absolutely astounding. I mean, I think you need to highlight that part. I can send you the video. You can add it in there so you can watch what he's saying and see if you agree with him. And let's look at where that man has come from and where he's gone. Because it just might be that some of the organizations that purport to speak for us, they're actually not speaking for us at all. They're speaking for the continuation of physicians remaining on the table with a fork in their sides.
Well, I listened to you talk on your interview with Randy, and the part that stuck out to me was when you two talked about the AMA. I never belonged to the AMA. We had the same thing, Randy. You joined the County Medical Society, and you were supposed, but the AMA, and if it did for you, great. But from a surgical perspective, the AMA never spoke for surgeons, ever.
It spoke for anybody.
I don't know who they spoke for, but
they got
the it was $1,000.
They got hold of
the 80s.
They got hold of the CPT codes, and they were making $1 gazillion a minute.
Yes.
And who cares?
I'll take this even extended out to the payers too. They know that docs generally are good people who are doing the right thing for their patients, and that they want us to focus on that. And as a result, they built into the way we are reimbursed the fact that they know we're going to do a lot of stuff for free. They know we're going to ignore a lot of the political stuff that's going on around us. And you know what, Marion, you bring it up. I mean, I think COVID has accelerated. It's like, no, this is not acceptable anymore. We can't allow, you can't sit back and just be passive. This is like being led down the path to, obliteration, basically. We are just being, we are being abused and taken advantage of. And people have to just say, no, this is no more.
Well,
I had
well, look at
I
the
practiced
surprise.
oh, sorry.
Yeah, good, Marlene.
Oh, that I practiced pediatric telemedicine, and I had a mom call me out from outside of an urgent care with a child with a corneal abrasion. And I said, ma'am, I'm so sorry, but you have to be seen. She's like, I'm trying to, but these people are not letting me in because I have my 5 and 3-year-old with me, and only one person, the patient, can come in. And, I had to prescribe an antibiotic for that kid's eye because I knew, she's like, my husband doesn't get home till later. I'm not going to leave my 5 and 3-year-old with random people so I can run him. I said, all right, but just bring him tomorrow morning to the eye doctor. But this is how low we've gone, that there's no critical thinking at all. It's just follow the rules blindly and not.
That's common. And
I know.
that's common sense.
Yeah,
That's
right.
just common sense.
leave your 5 and 3-year-old in the car in Florida by
Yeah, come
themselves,
on.
right? Like,
I almost had security called on me a couple of months ago. My wife had breast cancer and had mastectomy.
I don't want to be the security guard that
So-
comes up against you is all I'm saying.
I'll tell you what, man.
You guys can't see him. He is a hunk.
I will tell you. Now, for years, anytime I finished my surgery, the first thing I would do would go out to greet the waiting family member or whoever was waiting for the patient, let them know everything was okay, and invite them back to recovery or to PACU just to, spend a couple of moments just to reassure everybody. I just wanted to go back to see my wife. We had already had a long day. And I was stopped by somebody who would not allow me. It's like, I'm a physician, I'm a surgeon. Do you mind if I just give my wife a kiss or something? Well, it's like, I almost lost it. I almost lost it. And it's like, you gotta be kidding me. And it was like, where's the critical thinking? Where's the courtesy? Is it this ridiculous? Have we lost all ability to be compassionate or communicate even?
Yeah, I had a similar
I'm just
situation.
venting.
Well, I think we all are to an extent, but I had a similar situation. I have a family member who has gone through first diagnosis of liver cancer, liver transplant, made it through liver transplant, and now has cancer again in the new liver. And we were seeing the oncologist for the first time. They went through their whole process. This was the transplant was done prior to COVID. Then the second diagnosis of liver cancer was as we were in the midst of COVID. And everyone from the physician to the social worker to the nurse to the pharmacist, every one of them said, well, it was very nice to meet you. You won't be coming back with her. We'll talk to you through a screen. And I'm like, are you kidding me? I had them all lined up. Every one of them used the comment, well, it's the rule. It's the rule. It's the rule. And my only comment back to them was shame on all of you.
Yeah.
I have an entire team of caregivers here, and not one of you is willing to advocate for this person. She's not married. She doesn't have children. I'm her person, and you're going to keep me out.
Rhonda,
So,
this is the
no
buzzword
excuse.
this is what you use. You tell them that your person is a fall risk, and then fall risk actually. So I did this recently when my uncle was a fall risk. I told my aunt to act like a crazy person that didn't understand English, and to demand that she go into the emergency room, that he is a fall risk because they would get in more trouble if he falls. And they can't afford but it's ludicrous that we have to go to this.
I tried that. I actually tried that because I talked to the administrator. They said, well, if there's a change in her care, which basically she meant if she's actually on death's door, then you may be able to come. Because what I did is I grabbed a wheelchair and I said, listen, this is how we're going to do this. You can't walk. You need me to take you in there. They wouldn't let me in.